This video shows a Lasik procedure. After draping the eyes to be sure the meibomian gland orifices are completely covered, 2 circular marks are made using a gentian violet-coated optical zone marker. Central optical pachymetry is then performed. The suction ring is then placed over the cornea and centered over the pupil. Note how the pupil dilates slightly as suction is engaged, indicating that adequate suction has been attained. The cornea is moistened using a supersaturated sponge prior to placement of the keratome head. The keratome head is placed over the pin and engaged on the tract. The tract is inspected to make sure it is free of any drapes or debris, and the forward cut is initiated. When the keratome comes to a stop, the reverse mode is activated by the foot pedal, and the keratome moves in a reverse motion. Suction is broken, and the entire keratome ring combination is removed from the eye. A cyclodialysis spatula is used to reflect back the superiorly hinged flap. Note that the flap is reflected on itself, exposing the epithelial surface while the stromal surfaces are opposed. The bed of the flap is then inspected for uniformity. Optical pachymetry is performed in the bed of the flap centrally to determine the central corneal thickness of the residual bed. A slightly moistened sponge is then applied to the surface to remove excess fluid and to assure a uniform and debris-free bed. With the patient fixating on the blinking fixation light, the centering reticule in the microscope is placed over the center of the pupil. The tracker is then activated, and with the patient continuing to fixate on the blinking light, the laser is initiated. The patient fixation is monitored during the entire procedure, and the central crosshair should be at or near the center of the pupil. The centering reticule is turned off, and using an irrigating cannula, the superior flap is repositioned. Irrigation takes place under the flap to float the flap into the exact position, with care being taken to align the gentian violet marks. A slightly moistened sponge is used to dry the gutter around the entire circumference of the cut edge. Gentle stroking of the flap is performed to assure alignment. A smooth compressor is used to compress the center of the flap. This manipulates fluid from under the flap toward the periphery and aids in compressing and removing any stria centrally. The sponge is again used to dry the gutter to promote adhesion of the flap. The stria test is performed using the blunt spatula. A viscous artificial tear is placed over the surface of the eye prior to removing the lid speculum and the drape. Following removal of the speculum and drape, the patient is asked to blink while observing the flap under magnification. The central leg ring should also be observed to assure it is round, central, and without distortion.